Good morning, my name's Dr. Jeremy McAnulty from New South Wales Health, and I'm here with a COVID update for New South Wales for Thursday, the 23rd of December 2021. Across New South Wales, 94.9% of people aged 16 years and over have received their first dose of COVID vaccine, and 93.5% have received 2 doses. Of people aged 12 to 15 years, 81.5% have received 1 dose, and 78.2% have received 2 doses. There are currently 347 COVID cases admitted to hospital, with 45 people in intensive care, 13 of whom require ventilation. There were 5,715 cases of COVID reported in the 24 hours to 8 o'clock last night, and there were more than 160,000 tests reported in the same period. Reminder to everyone across New South Wales to get vaccinated now if you haven't yet had your first dose, and to get your second dose when it's due. And we continue to see mostly unvaccinated people admitted to ICU. Thanks to everyone for coming forward to get a booster vaccine. New South Wales' booster program continues to ramp up, with New South Wales Health already delivering more than 130,000 vaccine booster doses to help people keep people safe and increase our immunity across the whole community. People aged 18 years and over are eligible for a booster dose 5 months after receiving their second dose of vaccine. If you haven't booked in for your booster dose yet, please do so, and 5 months after you get your second dose. You can go to the New South Wales Government website to book your dose. New South Wales Health thanks the community for their incredible response in coming out for testing as transmission rates for COVID increase. New South Wales Health advises people to get tested for COVID if you have any symptoms at all, even if mild, and to self-isolate until you get a negative result. This applies to everyone, even if you've been fully vaccinated. New South Wales Health continues to remind people to practice COVID-safe behaviours, including wearing a mask in settings where you can't physically distance. Around a quarter of people who are exposed to COVID who end up getting COVID infection do so after the first 7 days after their exposure. For the next 7 days, close contact should exercise caution and not enter high-risk settings, should avoid large indoor gatherings, and use rapid antigen tests if coming into contact with vulnerable people. Get tested and stay home if you have even the mildest of symptoms. Don't visit family, friends, or go to social events if you are unwell. Wash and sanitise your hands regularly. If you don't have symptoms and are planning to go out, particularly where there are vulnerable people or crowded areas, consider getting a rat test before you go out. So again, thanks to everyone for coming forward to getting your vaccine, getting your booster shots, and coming forward for testing if you have symptoms. It's really important that we all practice those COVID-safe behaviours of good hand sanitation, washing your hands with soap and running water for 20 seconds, or using alcohol-based hand rub, social distancing, and using a mask when indoors and you can't social distance. Thanks very much.